Hello, welcome to NP Table Talk. It's me, Ladia Lala Reyes, and I'm here with Surgical Associates, Dr. Stephen Vela.
Chris Yalaman, DNP.
Marjorie Rodriguez, NP.
Wonderful. And so we're just going to kind of kick off and say thank you for joining us here today, Dr. Vela.
Thank you for having me.
We love your team of Surgical Associates.
Thank you.
And so we just wanted to kind of see what's kind of going on with Surgical Associates right now.
Well, it's always a work in progress, and we have a number of partners or a couple of partners that have retired in the recent past, and some new additions. And we've sort of diversified. We've got a surgical oncologist that joined our group. We've got a relatively young partner, and then we just had another gentleman, Dr. Uribe, join us, who will be working at this point mostly at Spawn Shoreline doing AV fistulas.
Nice.
Oh, awesome.
So we continue to diversify and grow.
Amen. That's what we need here in South Texas for sure.
Exciting times.
So one of the questions I kind of had, and I guess you kind of get this question often from students and everything, is what kind of inspired you to become a surgeon from the array of settings that you guys can work in?
Well, that's kind of an easy one. My father was a general surgeon. He's born in Mexico and practiced in Laredo down on the border, and so obviously I had a very early exposure to medicine and general surgery. I admired him, and then I also found it suited my personality well. I kind of like the technical aspect of it, so it was just a perfect profession for both me and just kind of honoring my dad.
That's awesome. Yeah. That's actually a great story.
Nice. So you're bilingual also.
I am bilingual.
That is something I think a lot of patients want in their.
I appreciate here in South Texas specifically.
And it's also one of the reasons I moved to Corpus. I trained a little further north at Dallas and had the opportunity to go anywhere, but I really like the culture and Spanish-speaking patients. So I know that there's a need, and I really enjoy it. Yeah, the culture is great, the language is great, so it does help quite a bit to speak Spanish.
Yes, and that's great for our community.
Yes, for sure.
And Margie, I know you had a question to ask.
Yes, Dr. Vela, I was wanting to ask, what do you find most rewarding about being a general surgeon?
Well, the thing I like about general surgery is that we get to identify problems just like every other aspect of medicine, but we also get to quickly correct problems. So sort of come in with a problem, we're able to take care of it. And so long-term care, with the exception of our cancer patients, people come in sick and they generally go home healthy. And I find that very, very rewarding. Yeah.
Very
That's
good.
amazing.
Thank you. Thank you for that.
Good. So we talked a little bit about this just a second ago, honestly, I know that laparoscopic surgeries were huge back in the day. Now that things are transitioning because we work in a world of medicine and healthcare, which is constantly evolving. Now there's robotics, and I know that's come to the coastal bend, and in recent years it's just growing. How has your practice kind of adapted to that?
Well, it's kind of an interesting thing because the transition from open surgery to laparoscopic was a huge leap as far as quality of care, return to work, pain, and it also gave us some options. And now we've developed robotic surgery that was interestingly developed primarily for military purposes and has since been adopted by academics and now private practice. So the younger generations of surgeons have been sort of exposed to it from very early on. Universities have financial options available to them that many private hospitals don't. And so they're very adept at robotic surgery. So, Doctors Reyes and Ewing and let's see who else, Dr. Mawe are quite facile with the robot, and some of the younger or middle-aged partners, I should say, Dr. Dye, and I'll be sort of embarking, and I think Dr. Ortiz is probably going to do the same. We're sort of slowly adapting it to our practices. But, people hear robot, and they think that it's, it's fantastic and all this, and the technology is out of this world. It is great. And we think it's probably important to offer that as an option to our patients. So I think probably within a couple of years, we'll all be performing robotic surgeries. Yeah, it's a great tool.
That's awesome. It's wonderful. So another thing I know about is on call, right? As a surgeon, you guys live on call, and I mean, we were talking in most recent episodes, life-work balance, and that's something that is essential. And I know you have family, right? Like all of us, right?
Yes,
And so
yes.
that's always a fine line of how we're balancing all those kind of things. And how do you feel? What's one of your biggest obstacles with that?
Well, that's interesting. You guys are pretty well prepared. You know, the call burden is what I have found has been the most demanding. It also can be extremely rewarding. But when I was younger, as was the case for all of us, we had endless energy. You know, at the time, I didn't have family. So you make a decision based on what you think is appealing to you then. And knowing that general surgery required a large burden of call was not an issue. But as I've grown into my practice, and now I have two young girls and a wife and things like that, I found that the call can be quite stressful. It's physically demanding, also very rewarding. Actually, the complexity of cases is greater, the acuity, obviously. But if I'm going to be honest, the hardest part about it has been the lawsuits. And I know, a little surprising to bring that up because it's not generally that anybody talks about. But I'm very forthcoming about those things. I've been in some situations that are out of my control. And unfortunately, or I don't want to say unfortunately, I don't blame anybody. I don't blame patients or attorneys. It's just a matter of trying to figure out what's going on. These lawsuits come about, and thankfully, all of my lawsuits have ended with good outcomes for me. But I've learned to accept that that's just part of the process. So you put yourself in the situation, high risk, high reward, and those things come. But it is emotionally taxing to go through a situation like that. So I would say the fear of having to go through that discovery process for something that goes wrong that's out of your control has been emotionally taxing.
I can only imagine that. Like, really. Yeah. I mean, I remember working in the operating room. You would be on call. Dr. Dye would be on call. I remember y'all go in, y'all get those things out immediately. You're helping those patients, and you're right. When you're doing the right thing by the patient, and then there's an outcome that you're just like, oh, that was out of my hands. It is unfortunate, and it is quite scary in that healthcare setting. So I'm glad you bring that up.
That's a good point. As long as you do the right thing and you can sleep well at the end of the day, that's the most that people can ask for.
Yeah,
we're all human.
Yeah, exactly.
Human. But yes, if anybody is dealing with a lawsuit out there or has one in their future, it's unfortunately just part of the landscape of medicine, and you try not to take it personally, although it's challenging at times, and you work through it. And sometimes you do something wrong, and there is a reason for that lawsuit to happen, and that's just part of it, unfortunately. And fortunately, I think it also helps.
I think we all learn from those experiences and everything involved, right?
Right.
So I think we all try our best by patients, and as long as we're on that right side, that's why I always practice in my head. As long as I'm always on that right side of that patient, this is going to bring me forward.
Just do the right thing.
Yes, do the right thing.
That's right.
Exactly.
You sleep well at the end of the day, and it's okay.
Awesome. Wonderful.
And if you have that nagging, like, did I do that? Go check.
Just go ahead and
you probably forgot it. So there's been plenty of times, like I said, we're tired, we're exhausted. We might have something else on our minds, and it's easy to forget. Like I was just telling Margie about our new, the computer system, which we're dealing with, the software Epic. And I said, I have it now on the bottom so I don't forget. I have to put what DVT prophylaxis, I'm doing, and what GI prophylaxis I'm doing. So it's what we call a hard stop. Like I can't save my note until I say, yes, I did this. Yes, I did this.
That's
what
good.
did I
It's
do?
a fail-safe. Yeah.
We
proactive.
And it's, very important. We sort of simplify things, at least in our profession, in general surgery, much like the military. We have these little sort of sayings, and one of them is you never get faulted for getting out of bed. So when you're tired and it's something that you think you can just check on later, it's best to just get up, check that box, and move along. Because, most of the times nothing bad will happen, but you try to avoid that one time that it does. So that's always a good rule.
So another question I have, is what's your favorite surgery to actually do? You know what I mean? Like, I'm sure everybody has their favorite.
I do. I like, gallbladder surgery is great. There's always a challenging gallbladder that comes around, but it's nice because they get in, they get out. So it's usually a 24-hour turnaround. If I were to give my absolute favorite, it would be a right-handed colectomy.
Really?
Because it's a big surgery. It's generally a relatively quick recovery. Many times you're doing something special like curing cancer, and back to work is quick. So it's just a nice combination of things.
Nice. That's good.
So I've had my gallbladder out. It was actually one of your partners that took it out.
I think we're all fans.
Great,
Good.
yeah.
Yes, for sure.
So in a primary care setting, when we refer to you guys, and we do often, what's the biggest help we can do for you guys?
Well, we've over the years had, in fact, I would say almost the majority of our patients come from nurse practitioners that are working in different clinics, and we find that just having them on the other end has made things a lot easier for us because, frankly, notes are complete, referrals are efficient, and they know their patients. There are a lot, I would say a majority of the private practice providers are actively engaged and know all of their patients very well. Mario Martinez, for example, he employs a number of nurse practitioners, but he knows his patients quite well. And then there are other providers that are sort of in solo practice, Andy Nisenblad, Michael Winnie, that are sort of one-on-one, and they also. But for us, I think really just knowing when patients need to be referred. We don't like to see things through the emergency room that we would prefer to see in the clinic. So having somebody sent for a screening colonoscopy before they come in with an obstructing colon cancer happens more often, we like to say, or symptomatic gallstones or a hernia before it becomes incarcerated. So just an awareness that that there's more than just medical aspects to a patient. There's also the surgical. So an inguinal hernia and all these things don't seem like big deals, but they can be catastrophic for somebody with a heart condition or who's on blood thinners. So just to identify those things before they become bigger problems is probably the best thing that most that we can ask for.
And then you're also going to get, like you said, a 1 to 2 day hospital stay versus maybe a week long because now we have to hold their Plavix right now.
Right.
Okay, well we can't do surgery till next week. So then they're in the hospital the whole time, and then they're exposed to other things in life.
Well, I would say that, it's interesting. A majority of the patients that come in through the emergency room, when you spend enough time talking to them, you find that there are opportunities far in advance where this issue could have been addressed on an elective basis, under a controlled setting with better outcomes. And a lot of times it's patient driven. It's just not convenient for them, but I think it's important for us to impress upon them that it's better, there'll never be a good time to have this done, but now would be the time.
Exactly. And you said it right, just like that.
We have to sort of help lead them a little bit.
You don't have time now, but the time you set aside right now is going to save you in the end.
Correct.
For sure.
Correct.
Yes.
Correct.
And I think
financially and time and complications and things.
Surgery is never a good time, right?
Yes.
So it's just being that realistic.
It's not like a concert or,
And then we've also said, you have to take time to take care of yourself because say, like I'm a single mom and I think, well, I just don't have time. I got my kids and this, but it's much easier to plan and get, plan to go get my gallbladder taken out and I'm only off for 2 days. Then, it bursts and then I'm in the hospital and then I might be septic. And then what's happening to my kids, so you have to take the time for yourself.
Right. I think that's probably
great.
the most important thing.
Good. Yeah. That's awesome. So do you have any questions for us?
I've actually seen pretty much all of the podcasts and I found it, fascinating about your journeys to nurse practitioner school and practice. My mom was a nurse and I have a sister-in-law who was a nurse. And so, we realize how important all aspects of this is a big machine and we all contribute. And we found that, we've been blessed to have great nurse practitioners work with us and we're expanding to include other nurse practitioners. I guess my question is, how do you determine whether you're going to be working in hospital-based or primary-based and what are the benefits and, or do you just sort of do
So that's certification sometimes and specialty kind of things that we're talking about, like she's acute care, I'm a family nurse practitioner. And
I'm adult gerontology.
So there's different specialties within the nurse practitioners, of course, and if you want to be more in that acute care, you do what Christy did. and you kind of grow from those aspects.
I think a lot of it's like our personality too.
Onto-
Like we always say, I'm a treat 'em and street 'em kind
Yeah.
of person.
I like to have those relationships with my patients, and I kind of, like you said, I know them just when they're coming in, I'll be like, oh, that's Margie. Yep, okay, I know already what's going on. And even with your team, I call your team and I say, hey, there's this patient, this is happening, I need them in. And honestly, I appreciate y'all's feedback on a lot of the things. Sometimes there's some verbiage in the imaging, and I'm like, I'm not sure what that is and what that entails. And so I've called your team members, and they'll be like, hey, it's not an emergency. I'll get them in tomorrow, and we'll get them worked out on an outpatient basis. And I know I appreciate it as a provider, and I know my patients have appreciated it on their end too. But it's personality based on, like Christy said, more of what kind of field you want to be in as nursing, because it's so versatile, just like
Right.
MDs and everything you can be.
And schedule wise too. I love my days off. Like I'm going to Panama City next week.
Yeah.
So I work 3 days.
And the
then
shift
I'm
work
off.
is different, versus the 8 to 5, 9
When
to
you
5
have younger
world.
kids, my kids are 23 and 18, so these
And
12s
we need
are
holidays
okay
off.
again.
I need
Yeah.
holidays off. I need weekends off. So it varies on that. But that's what I like about nursing. It's so versatile.
I don't think anybody likes working and not having time off. I think it's important. And you know what? I think that's really important. I have Michael Winnie's son, Chris Winnie, is he's been a good friend of mine since he was a kid, and he shadowed me, and he went to medical school, and now he's actually accepted to the family practice residency.
Oh,
And
that's
so
awesome.
I hope part of the benefit in spending time with me was, hey, you got to make a decision that suits your personality and your lifestyle, not only now, but also in the future. So he's going into family practice, and he's looking really forward to it. He's going to follow in his dad's footsteps, and he's going to have time off.
That's amazing.
That's
And
what
it's
y'all have that in
important.
common. Y'all
It's
follow,
important.
that's pretty neat. I like that.
I just recently we took our kids, on spring break, and once I get there, you realize how important that time off is, because you don't realize how tightly wound you are until you decompress.
Yeah, there's
Pretty
life.
good. So yes, you got to take care of yourself and sort of structure some time out to spend with your family and yourself, because I think it benefits everybody.
Yeah, so that's commonalities.
It
for
is.
Sure.
I think we're all kind of more similar than we think.
All right, amen.
Yeah.
Amen. That's awesome.
Well, I think that was a great talk.
Yes.
And thank you so much,
Yeah,
Dr.
sure.
Vela,
Yes.
of course. I guess, follow us if you have any questions also, we will relay them to Dr. Vela. If there's anything you want to ask him, you can email us at nptabletalk@gmail.com. Follow us on Facebook, NP Table Talk. Same thing for YouTube and a podcast, Spotify.
All right,
But,
thank
and then
you.
we'll see you next
Yes,
time.
thank you.
Bye-bye.
Bye.
Thanks for having me.
Yeah.